Systemic mastocytosis is a condition where too many abnormal mast cells build up in your skin and organs, causing a variety of symptoms such as itchy skin, bellyaches, rapid heartbeat, feeling lightheaded, and other problems. While there is no cure, treatments are available to help manage the condition. Mast cells are part of your immune system and help fight off illness and heal wounds. In systemic mastocytosis, extra mast cells can gather in different parts of the body, including the skin, bone marrow, bones, and digestive tract. Certain triggers can cause these mast cells to release chemicals like histamines, which can cause flushing of the face, neck, and chest, itching, hives, and other symptoms. In serious cases, systemic mastocytosis can interfere with how your organs work and may even cause life-threatening allergic reactions called anaphylaxis. In these situations, immediate medical help and the use of an epinephrine autoinjector may be necessary. It's important to have a support system in place to help manage the emotions and stress that can come with a long-term condition like systemic mastocytosis. Family and friends can provide the support needed to meet the challenges of this disease. Systemic mastocytosis is usually not inherited from family members. Instead, it is caused by a random change in the KIT gene, which affects the mast cells in the body. These cells play a role in the growth and development of the body. While signs of systemic mastocytosis can appear at any age, they are most common in adults, usually in their 40s or 50s. People with systemic mastocytosis may experience symptoms when certain triggers cause their mast cells to release chemicals. These triggers can vary from person to person but may include alcohol, spicy foods, changes in temperature, insect stings, stress or anxiety, surgery, vaccines, and certain medications like aspirin, opioids, and NSAIDs. However, it is also possible to experience symptoms without any specific trigger. The way you feel can be influenced by the type of systemic mastocytosis you have. There are 5 main types. Indolent systemic mastocytosis, ISM, which progresses slowly. Systemic mastocytosis with an associated hematologic non-mast cell lineage disorder, SHNMD, where another blood disorder accompanies systemic mastocytosis. Aggressive systemic mastocytosis, ASM, which develops quickly and can cause organ damage. Mast cell leukemia, MCL, a fast-growing disease with a high number of abnormal mast cells in the blood or bone marrow. Smoldering systemic mastocytosis, associated with more severe symptoms and potential organ dysfunction over time. Symptoms also depend on the location of the extra abnormal mast cells in the body. For example, too many abnormal mast cells in the skin can cause a rash, itching, or flushing. These symptoms may occur after a trigger and then disappear, or they can persist. Some potential issues include nasal congestion, fatigue, headaches, stomach pain, bloating, diarrhea, nausea, vomiting, lightheadedness, low blood pressure, rapid heartbeat, enlarged liver, spleen, and lymph nodes, anemia, bleeding disorders, and osteoporosis. Mental health concerns such as attention problems, anxiety, or depression may also occur, although it is unknown if these problems are due to a buildup of abnormal mast cells in the brain or the stress of living with systemic mastocytosis. The doctor will ask about your health history and perform a physical exam. Based on your symptoms, you may need the following tests. Skin biopsy. A sample of your skin tissue is removed and sent to a lab to check for a buildup of mast cells under a microscope. Bone marrow biopsy. A sample of your bone marrow is taken and examined for mast cells and signs of other blood conditions. Blood and urine tests. These tests check for chemicals or substances related to mast cells. A complete blood count can reveal if you have anemia or another blood disorder. Genetic test. Lab technicians check for changes on the KIT gene in a sample of your blood, bone marrow, or tissue. Imaging tests, X-rays, ultrasounds, and CT scans may show problems like bone loss or an enlarged liver, spleen, or lymph nodes. Endoscopy or colonoscopy. A doctor uses a thin, flexible tube with a camera to examine the digestive tract for ulcers, bleeding, and mast cell buildup. Tissue samples may also be taken and checked for mast cells. When you go to see your doctor, it's a good idea to bring a list of questions with you. Here are some questions you might want to ask. What type of systemic mastocytosis do I have? What treatment options are available to me and what are the goals of each option? What treatment plan do you recommend for me, and why? What are the potential side effects of the treatment I will receive? Is it possible for me to have a severe allergic reaction, and what should I do if that happens? Are there any home remedies I can try to help relieve my symptoms? Are there any medications or activities I should avoid? How often will I need follow-up tests or appointments? Your doctor will create a treatment plan based on your symptoms and the type of systemic mastocytosis you have. The treatments may include antihistamines to relieve skin reactions and digestive system symptoms, epinephrine to treat anaphylaxis, proton pump inhibitors to reduce stomach acid and ease digestion problems, mast cell stabilizers to block mast cells from releasing histamines, steroids to help with skin, nasal, and respiratory symptoms, and to treat anaphylaxis, targeted therapy to block specific proteins or genes involved in the disease, chemotherapy if your systemic mastocytosis is fast-moving and causing significant damage to your organs, stem cell transplant or bone marrow transplant in rare cases. To manage systemic mastocytosis, it's important to avoid triggers that can worsen your symptoms. These triggers can include stress and spicy food, so it's important to keep track of what causes your symptoms and discuss it with your doctor. Additionally, because this disease can lead to life-threatening allergic reactions, it's crucial to carry an epinephrine autoinjector with you at all times for emergency situations. The development of systemic mastocytosis depends on the type you have. The mildest type, ISM, progresses slowly, with symptoms slowly worsening over time. However, more serious types like ASM and MCL progress more rapidly. ASM may require treatment for issues like bone loss, while MCL, which is rare, can lead to blood disorders, including leukemia. After your diagnosis, it's important to have regular follow-up appointments with your doctor. They will monitor your disease and ensure that your treatments are effective. Managing a condition like systemic mastocytosis can sometimes feel like riding an emotional roller coaster. If you're feeling overwhelmed, it's okay to seek support outside of your immediate circle. A support group can provide valuable understanding and connection with others who are going through similar experiences. These groups may meet in person, over the phone, or online. To find a support group, you can ask your doctor, social worker, or others who have systemic mastocytosis. You can also visit websites such as the Mastocytosis Society, RareConnect, and Mast Cell Action. If you find yourself struggling with feelings of depression or anxiety while managing your condition, it's important to talk to your doctor. They can connect you with mental health professionals who specialize in treating these challenges.